Yeah, this really speaks to a lot of the fear that's out there. Anytime there's something new and you have that lack of knowledge, is going to be fear. So what we want people to understand is that AI is not meant to replace you. It's meant to enhance and augment. And we see this even right now with things like hallucinations, data accuracy, and particularly when it comes to scientific and medical information. Even though it might provide you a link or even a reference, when you actually click on that link, a lot of times it's not accurate. So you do have to have a baseline level of expertise and use continue your clinical judgment. And at the end of the day, we're trained. You don't treat machines and data, you treat the patient. It's the same thing with AI.
Exactly. I completely agree with what she said. When we look at the patient, we're looking at more than just their medical history and their previous medications. We're looking at them as a whole person. And AI is using a much more narrow lens to view the patient. And so while it's good at pattern recognition and evaluating photos, it doesn't have enough information to be able to make those clinical decisions, the ones that we make based on our knowledge and expertise. And so I believe that we should always be keeping a human in the loop, and then just making sure that the providers who are using AI in their clinic, that they just have proper education and they understand how to use it safely.
So, right now, AI is really helpful when it comes to giving us our time back so we can spend it with the patient. So whether that's being able to you take a picture, you can take a picture, you can put in your own words, and you can really now, there's like 4,000 diagnoses in dermatology. You only have 10 minutes. So it can help narrow you down and get to a treatment plan much faster. It can help identify and separate things like age that are age related or skin of color. If language is an issue, it can do that for you. It can help you with charting. So now I'm spending less time charting. I'm spending more time talking to my patient. My patient may have used AI to prepare for this visit. So now both of us are using our time much more wisely. We're getting to their problem much faster, and both of us walk away feeling like we got what we came for. So for me, when I think about the NP using AI, even if they don't have a background in dermatology, they're going to have, especially if we know that AI tool, that we know there's transparency in how that AI tool was built and the data that it was used, and it represents a broad spectrum of the population. We've addressed the biases that are inherent in AI. Then that NP, who Jade said is properly trained, will know how to use that tool, where to use their own clinical judgment, and it's going to buy their time back. All of us are going to talk to you about our time. And anything that gets us more in front of the patient is why we even came into this profession to begin with. And so even if you lack that specialty training, you're going to have some tools that are readily available at the point of care to make more use of your time.
Yeah, and to add to what Dr. Madison said, I also think that it could be helpful in some of those triage decisions that nurse practitioners are making in a primary care setting. So, if they're unsure if a lesion or a rash, inflammatory condition can be managed in their setting, they can use AI to help with that decision and help determine, like, should it go, should it stay, or even how urgently a referral should be sent to dermatology. So we kind of talked about this a little bit, how AI can help in making those referral decisions. I think that in the research that what we found was that primary care providers, many of them have limited dermatology training, which can make them feel very unsure about the decisions that they're making about the care of the patient, prescriptions, diagnosing. And so that may lead them to automatically refer a patient when in fact they can treat the patient and they have those tools and they can figure out, okay, well, this is the first line treatment or the second line treatment, and then I can refer patients after we've done these things. I think that AI just, it's a theme running through this entire interview, that it's a layer of support for the clinician making those decisions. And they can use it but not rely on it too much and to make those decisions.
It's going to come to trust, both for the clinician, because that's our number one thing. It's keeping our patients safe, right? Are we protecting their data? And then are we protecting our intellectual property and teaching the patient how to do the same thing? That's the same thing in the community, is that trust. And that's where nursing is super instrumental in this, because we have over 20 years of trust with the public. And so we can leverage our trust that we have after being properly educated on how to utilize AI safely. We can leverage that trust that we have. And now that we have more time because AI is helping us be more efficient, we can have a much more helpful conversation with the patient about how to use it, how we're using it, give them what to, and then red flags, what to look for, and then how to use it safely and where to get more education and learning for themselves and from credible resources. That's a big part of it.